capacity, they are living, so they have the capacity to build themselves up. In the course of building themselves up, they grow, and the growth is, this growth is about division. What do I mean by division? It means that one cell becomes 2, the other 2 become 4, 4 becomes 8, and so on and so forth. That's how the cells of the body grow. And these cells are now arranged in, like I was trying to use the example of a house. You have the wall of the house, you have the inner part of the wall, you have the outer part of the wall. Of course, the outer part is the outer part of the house that you paint. The inner part is the inside the house where you paint and also decorate. You know this. The painting, the blocks, the outer paint, the inner paint, all of them together are built up by cells. Sorry, I think someone is
you need to mix people if you're not talking.
Yeah, I think the admin can actually mute and just leave the speaker on mute.
Yeah, Shola, please, I've transferred the power to Stephen. Can you do that?
I think the admin should have the power to mute all.
Hello, so can I continue? Yeah. Okay, so cancer cells, like I said, can grow anywhere. So let's go on. So the normal human cells grow and multiply to form new cells as the body needs them, like I said. And when cells grow old, they become damaged, they die, and new cells take their place. This is the normal life cycle of cells. I mean, it's the normal cycle of life for cells. They grow, you start the cell, it grows and it dies. This is all these levels, I mean, the growth, the death, they are all controlled, in the human body. It's all programmed, and there's control. But when there's loss of this control, that's when you have cancer. So, but what is cancer in itself? How does cancer develop? Cancer is we must first understand that cancer is a genetic disease. What do you mean by genetic disease? It means that, disease of the genes. What are genes? Genes are the materials that the computer people will understand what I'm about to say now. They are the program that is in the human body, the program that helps us to function. It is what programs the way we look, the way we behave, the way things happen in our body, the way cells grow. All the activities of these cells are programmed into the genes. So when there is an alteration in these genes, the cancer develops. So the question then is, what are the damages that can occur in the gene that will lead to cancer? There can be 3 important cell damage. The first is the proliferation. I mean, when we say proliferation, when the cell division by itself, that is when the cells divide, the program that divides the cells, there can be error in that. When there's an error in the program that divides the cells, what do we have? We have uncontrolled cell division. Now, when cells have DNA damage, the body has made it in such a way that when there's a damage to the DNA, the body kills that cell, so that the cell does not, the damaged DNA does not, proliferate. So the body has a way of killing those cells. When there is now alteration in the ability of the body to kill damaged cells, cancer also develops. Now, what are the things that can damage DNA? There are materials in the body, in the environment that can damage DNA, chemicals. A lot of chemicals, especially tobacco. We all know that tobacco smoking is a major cause of cancer. Major type, so many kinds of cancer. So when you have damage, tobacco causing DNA damage, harmful rays like radiation. Hello?
Yes, Stephen. Shola, to mute everybody. Shola?
Stephen, you muted.
Yeah, it's not him. Shola that muting.
Hello?
Yeah, Stephen, yeah. Sorry,
Yeah,
Shola.
we can hear you.
So I can't share my screen too.
Shola, can you make Stephen co-host, please?
Please, how far did you hear me, please?
Stephen has something there. It's called Stephen Osasan.
Hello.
Hello, Stephen. Continue now.
Sorry,
Stephen.
yeah,
share my
he's not
screen.
able to share his
I
screen,
can't
but Shola again is the chief host. He's trying to get that back. Sorry, everybody.
Shola, are you asleep? Wake up
No,
and share
he's
the
don't worry.
screen.
He's doing it. There's no point to. Yeah, he's doing it. Don't worry.
Oluwa. Shola Igbodu,
Yeah, it's coming. Sorry.
Where Shola Tini hangover? Where Tini
Igbodu
is hangover?
Stephen, you're not the host, so you can control everybody.
and
And you can share it.
I can control you too. Okay. So, as I was saying, can you hear me? Can you hear me?
Loud
Yes,
and
Stephen,
clear.
go ahead. Loud and clear.
Loud and clear.
Thank you. So I was trying to say this. That the errors, what can cause error to be,
co-host,
what are the errors that can happen to the cell that can lead to this damage? I said there can be, a problem with cell division. When there is a problem with cell division, there's no control cell division. The cells just grow and they just continue. When there's damage to the DNA, I said when the DNA of a cell is damaged, the body has a way of killing those cells. But when those cells are not, you cannot kill them. When the body, the mechanism to kill those cells is not there, then the cancer develops. And I was trying to give you an example of things that can cause DNA damage. Examples are chemicals, and the main principal example is tobacco smoking. Then I talked about harmful rays. Of course, you must have heard when they said, Hiroshima, Nagasaki, Chernobyl in Ukraine, when those harmful rays, were released into the atmosphere, you will remember all that happened, the different cancers that developed. Of course, even the normal sun rays that we on unfettered exposure to sunlight, we have, ultraviolet rays, they can cause, skin cancers. Then a lot of cancers are also inherited, such as, of course, we know that a lot of breast cancers, especially young people, are inherited cancers. That is why when there is a member of the family that has cancer, it's in the best interest of members of that family to screen themselves for such cancers as early as possible. Let's go on. As we grow old, the ability of this body to clean up, I remember when I said when the cells have DNA damage, the body has a way of cleaning those cells up and killing those cells. But the ability, as you are getting older, the ability of the body to clean up those things reduces. And because of that, it then means that some of those damaged DNA materials or DNA, cells with damaged DNA can, escape and multiply. That's why you see a lot of cancers. A lot of cancers you find them in older people. So as we're growing older, you should now know that your body, the ability of your body to do what it used to do to protect you against some of these things is just reducing. So, like I said, be prepared. It's not just for scouts alone. Be prepared. The future is you have to. As getting older, you should prepare yourself for certain challenges. So let's talk about normal cells. What are the differences between normal and abnormal cells? I mean, normal cells and cancer cells. Number one, cancer cells grow in the absence of signals telling them to grow. They don't need any signal to tell them to grow. They just grow. Normal cells grow and they receive such signals to say, don't stop growing, grow at this level. No, cancer cells don't do that. They ignore, the cancer cells don't listen to stop growing. They just continue. And naturally, they are supposed to die at a point in time when cells grow, they're supposed to die. That's programmed, that's kind of death is what we call programmed cell death. It is programmed in the cell that they should die, especially the cells of the skin. Your skin, the cells that you are seeing on your skin today is not what was there about 3 or 4 weeks ago, because it's constantly being replaced by new cells. All the old ones are peeling off, the new ones are getting there. That's why you have dandruff, you see on your skin, you have these scaly things. It is because some cells are dying, some cells are growing. Cancer cells also do some very interesting things. They trick the body. They trick the immune system of the body. Naturally, the immune system of the body is supposed to kill anything that is strange. Of course, cancer cells are strange because they have, a strenuous genetic materials that make them, strangers in the body. So they are supposed to be killed by our immune system. Of course, with competent immune system, some of them can actually, contain cancers. Some therapy these days are targeted at using immune system of the body to kill some of those cancer cells. But you know what cancer cells is? They trick the immune system to help them to grow, such that the immune system of the body actually help them, because there's a way they find a way of tricking the body's immune system. They also accumulate different kind of changes in them that make them, the part of our genes, they duplicate, they replicate, they just change the genetic nature of the cells, and that's why they behave the way they behave. Now, one other thing that you notice that most people with cancer, they lose weight. Why do they lose weight? Because the cancer cells themselves are parasites. They compete with the normal nutrients that the body needs. So you see that one of the things is they take the nutrients that the body needs and use it for their growth. And that's why you see a lot of people with cancer, weight loss is a significant symptom of cancer development. This is one of the parts I told you I'll be talking to myself. If you understand this part well, but I want you to note a few things. Look at those arrows there. Every cell go through this cycle. It's a cycle of, we call it cell cycle. It's a cycle of life of a cell. It comes in, it grows, and it dies, and it lives the cell cycle. There are three types of cells in the body. There's some cells called labile cell, like I was telling you, the skin, because it grows constantly. Another one is called the stable cells. They enter this cycle only by when you stimulate them, like liver. The liver cells, by nature, they are stable because they don't always come into this cell cycle, usually. But if you cut the liver has the ability to grow back. Why? Because it can come back into this cell cycle. It has when there is a trigger like that injury. When you cut it, you of course inflict an injury, it stimulates the growth of the liver back, and so the liver can grow back. But there are some cells that don't grow back, and that is why when people have, example is the brain. When people have brain injury, you notice it is difficult to get them back, and that is why you see people who have stroke, who have some of those things, because the cells of the brain don't grow back like that. It's difficult for them to grow back. It's difficult to get them restored over time. That is why you want to prevent injury to the brain as much as you can. Now, when you look at this cell cycle, how does cancer develop in them? Now, if you look at that, my blue arrow there, for cells to grow into the cell cycle, they must pass through what we call the checkpoints, like the police checkpoint. They must be sure that the credentials of those cells are intact, that you cell, before you can continue to grow, you must be sure that your DNA is intact. You don't come and give us problem. But like when the police also is not functioning well, what happens? All sorts of criminals can get into the society. That is the exact same thing in cell cycle. When the restriction point, the checkpoints to scrutinize the cells are not in place, what happens? The rogue cells go and they begin to cause problems for people. And that is why a lot of therapy today are targeted at some of those checkpoints. You want to look at some of the materials in those checkpoints. You can use them to stop a lot of, a lot of cancers. Let me just leave it there. Don't let me bore you. So what are the agents, that causes cancer? We call them carcinogenic agents. These agents inflict injury on the cell. What are they? There are three important classes of these agents. You have chemicals, you have radiation, and you have microorganisms. Some of the chemicals, like I mentioned earlier on, think until you do X-rays, you do CT scan, especially CT scan. CT scan is multiple X-rays, if you don't know. CT scan is multiple X-rays. So when people expose themselves to, a lot of X-rays, CT scans, you are exposing yourself to carcinogenic agents, actually. So, and excessive sunlight too, especially for those who have light skin, white people, albinos, they have, because of this exposure to this, radiations, they are prone to a lot of these cancers. Now, there are some microorganisms that lead to cancer. I need you to know that some of them, you know that cervical cancer is caused by a virus, human papilloma virus. Gastric cancer is, a lot of gastric cancers are caused by, an organism called Helicobacter pylori 2. Of course, when we treat ulcers, they will give you some drugs to eliminate Helicobacter pylori in your stomach. It is also it's also preventing cancer. Now, understanding those microbial agents and preventing them, kind of stopping them, helps in limiting these cancers. Now, talking about statistics of cancer, sincerely, I chose not to go very deep into this in this presentation. Why? Stephen Olabi died, right? For Stephen Olabi, for his family, for all of us, Stephen Olabi's death is 100%. When we look at cancer statistics, we talk about, the trend is increasing, reducing. Interestingly, statistics in Nigeria is a bit dubious. I'm sure Blessing can bear me witness. You realize that to get the statistics, to get the exact figure of diseases in Nigeria, you need cancer registry. Those cancer registries are scattered here and there, and we don't have proper statistics. In the past, if you look at the data, the cancer data in Nigeria in the past, they will tell you that, cancer is not common enough in blacks. But we know, Nigeria and Africa, they say because of the kind of food we eat and blah, blah, blah. It is totally not true. It is because we were not it is our cultural, the socio-economic situations of our country then that made cancer to be a bit cryptic. People think they are not there. They are there. But now that the health system is getting more modernized, you see that we are now discovering more and more and more. We now think, it's increasing, it's not increasing. It's just that we are finding more. We now have tools to get more, to find more. Unfortunately for us, we really don't have, proper statistics to give us the proper data for cancer in our country. Although I tried my best to get some of this, but for me, cancer for every family is 100%. It's not about the statistics. So I'm just going to skip this statistical part. Let's look at colon cancer. That is the basis of why we are here. What's colon cancer? Colon cancer is the same thing as colorectal cancer. It's just that the colon, you have the colon, you have the rectum. The rectum is a continuation of the colon. And generally, we look at them together in one bit. So colorectal cancer is a disease in which cells in the colon or the rectum grow out of control. That is, I've mentioned why cells grow out of control earlier on. The colon is the large intestine or large bowel, that's what we call it, while the rectum is the passage that connects the colon to the anus. Now, look at the risk factors for colon cancer. There are two, it's divided into two. We have modifiable risk factors and what we call non-modifiable risk factors. What are modifiable risk factors? These are factors that you can control yourself. We know that those who have excessive weight, like obesity, those who are obese, are at increased risk of having colon cancer. People who have sedentary behavior. What do you mean by sedentary behavior? Most of us actually have sedentary behavior, inactivity. We work in an office and we stay, you sit down for hours and hours. For someone like me, I'm a pathologist, I sit down on my chair with a microscope. I've seen sometimes I sit for 10 hours, sit for 12 hours, doing the same thing. That inactivity is a big risk factor for colon cancer. It has been said that red meat, red meat and processed meat are real agents, and they are the International Agency for Research on Cancer, they classify processed meat and red meat as possible carcinogenic agents. So that it is not that it said that eating red meat increase the risk for colon cancer. Smoking, of course, smoking is. I don't know why people smoke, but I don't know the attraction to it. But we know it is verified that smoking is a major cause of cancer, different types of cancer, breast cancer, colon cancer, lung cancer, etc., etc. It's risky, but I don't know. But you can't stop the tobacco industry. It's one of the biggest industries anyway. So now alcohol intake increases the risk of colon cancer. The risk increases with the amount that is consumed. The more you consume, the more the risk for cancer. It's said that healthy drinkers were found to have 45% increase in the likelihood of developing colon cancer compared to people who don't take alcohol. Now, modifiable risk factors, there's nothing you can do about these ones. They are just there. Family history and heritage diseases, of course. When families have the genetic predisposition to these cancers, there's nothing you can do. You can only screen and try to do preventive things, put preventive measures in place. There's colon cancer in particular have propensity for being an inherited cancer. There are some, there's this familial adenomatous polyposis syndrome and another syndrome called the Lynch syndrome, where these have been associated with increased risk of colon cancer. So when you have patients, when you do colonoscopy for patients, you try to set, I'll tell you, we'll talk about colonoscopy later. When you do colonoscopy for patients and you have more than 100 polyps in their colon, of course, usually those people are at very high risk of developing colon cancer. And there are other, like I said, there are other syndromes, like what I said, Lynch syndrome. We call it hereditary non-polyposis coli, where you have, it's not polypoid, but you have this alteration in some genes and it is inherited. When you have such inheritance, those individuals have propensity for cancer. Now, what is the importance of that here? The importance is that there are studies that have shown to us now that a lot of those inherited cancer syndrome, especially colon cancer syndrome, like those Lynch syndrome, is a lot in Nigeria. In Nigeria in particular, there's increase in the number of people that have those inherited diseases. Inherited syndromes. But in the past, we don't know because we are not screening for them. So that's why it is important that, because we don't know what a lot of our genetic, we don't have a lot of knowledge about our genetics. It is important that we just go out and screen ourselves for some of these cancers, so that we don't just put ourselves in a position or assume that nothing is there when they are actually there. Now, there's inflammatory bowel disease. This is a disease in individuals who have this disease, that is Crohn's disease or ulcerative colitis, have increased risk of developing this cancer. So anybody that has ever been diagnosed with either of this disease, this inflammatory bowel disease, should increase their screening. They should be screened more for colon cancer. Race and ethnicity. I need to emphasize this. All over the world now, especially in multiracial societies like the United States, North Africa, North America, South Africa, and in multiracial environments, it is known that a lot of cancers, especially colon cancer, is more among blacks. In the past, we used to think that blacks are immune to cancer. Maybe because we just have this feeling that we are immune, maybe because we are black. It's not true. But the question would be that, why are blacks in multiracial environments prone to cancer? It is simply because of the socioeconomic situation of blacks too. So it means that cancers also reach socioeconomic class. So it is important then that in low socioeconomic societies, I'm sorry to say, like our country, Nigeria, it is important that we raise awareness on development of cancer screening, and have high index of suspicion on development of cancers and how it affects individuals. Now, what are the symptoms of colon cancer? One thing that you must understand about colon cancer is that it doesn't have a specific symptom that you can say this is the symptom of colon cancer alone, that when you have this, you have colon cancer. A lot of the normal symptoms that people have can also be symptoms of colon cancer. But how do you now look at them? Let's look at it. Persistent unusual change in bowel habit. You just realize that your bowel habit is just not changing. This way you have constipation, you have constipation with diarrhea and all the rest. Go and screen. When you have blood in the stool, this is a very important, very, very, very important symptom. Although it is not only colon cancer that can give you blood in the stool, there are other things, amoebiasis and some other things can give blood in the stool. But blood in the stool, is an important sign of colon cancer. Of course, you can have diarrhea and constipation, especially constipation. When you just have this unusual constipation, you take a lot of, drugs to relieve it. It's not going. You should go and screen. Of course, you can have abdominal pain. Those are not specific symptoms. But like I said earlier on, unexplained weight loss. Unexplained weight loss is a very significant. Symptom of cancer. But before I go on, I need to tell you something. I had an experience sometime, and I need to share it with you so that you don't start having problems that I had that time. Knowledge can be very dangerous. When I started learning in medical school, there was time I had wound in my leg. And I realized that people say when you have infection, it can spread from any part to your brain. And I started having headache. So immediately I started thinking I had meningitis because of the wound in my leg. And for a long time, I was afraid of meningitis because of the wound in my leg. Because you have some of these symptoms does not mean you have colon cancer. So don't develop this unnecessary fear that, because I'm losing weight, that's colon cancer. Because I have this. No. The only way you can know if you have or you don't have is when you screen. And that is why the emphasis of this presentation is about screening. It's about going out to, not to think you can't, but at the same time not to be afraid that you have. There may not be any symptom of colon cancer. You must understand that. Especially those at the early stage. Some may have colon cancer and may not know it at all. That is why getting screened regularly for colon cancer is so, so important. So how can I reduce my risk of colon cancer? So the major approach is screening. So go get screened for colon cancer, especially from age 45 and above. Why do you have to screen? Like I said, almost all colorectal cancers have precancerous polyps, abnormal growths, and you can see, if you look at the picture here, you see that there is this thing that looks like mushroom in the colon. That's a polyp. Almost all colorectal cancers start like that. Although some of them are not, some of them can start with just an ulcer. Instead of having a growth, it will just be an ulcer within the colon. Such polyps can be persistent for a couple of years before they become cancers. But if it is there and you cut it off as early as possible, then you're saved from it. So when you do this screening, you are able to find these polyps and you are able to prevent the disease. There are 5 types of screening tests that's available. You have the fecal occult blood test, sigmoidoscopy, colonoscopy, virtual colonoscopy, and the test. Unfortunately, some of my friends in Nigeria have been doing a lot of work in trying to get some of these tests to become become a policy of government that any individuals can be exposed to them. But there's little you can do. So what is fecal occult test? The fecal occult blood test is a test to check stool for blood that can only be seen with a microscope. That is it. You go to this can be done anywhere. What you do is that they take your stool, they just check if there are blood cells in the stool. You may not see the blood with your naked eyes, but under the microscope you'll be able to see them. That is a very simple test, the simplest test for cancer of the colon. Unfortunately, by the time you start seeing blood in the stool, it's likely that cancer has developed. And that's why, for me, fecal occult blood test is a late kind of test. Now, there's another, for me, the two I'm going to mention now, sigmoidoscopy and colonoscopy. What do you mean by sigmoidoscopy? If you remember, I told you the sigmoid colon, the colon is divided into this, ascending colon, transverse colon. Let me show you on my picture here. You have this is the ascending colon, this is the transverse colon, this is the descending colon. You have the sigmoid, you have the rectum, then the anus. Sigmoidoscopy is getting a probe. We get this probe like a pipe into the sigmoid colon.
Stephen,
light there, visualize it and look if there's anything there. And if there's anything there, some of this.
Sorry,
Hello?
Stephen. Yeah, I'm sorry to disturb your flow. Can you mute everybody? You are the chief host. We can't do the. Somebody is snoring. Can you please mute everybody?
Somebody is snoring and the person is snoring very loud.
Yeah, it's okay. It's okay.
It's
nature. Yeah, not boring. Probably worked overnight or something like that.
You might not boring. You're doing a good job. Well done.
You could have made a co-host, but sorry that we have to talk
what to do.
I think,
okay.
Let me see. You've not been able to do it. There's one Olatubos. If I made you a co-host, but if it's possible.
I don't know. Sorry, I can't find the person. If you tell me.
Okay, so the person is talking. Can you please mute yourself, Olatubosun, if you don't mind? Who is Olatubosun, please? Can you mute yourself? I think that has subsided now. Stephen, you want to go ahead, please?
Thank you. I'm sorry for that.
You can't cheat nature. Sorry about that.
So when we talk about sigmoidoscopy, what is a sigmoidoscopy? Is like using this probe. Is a thing to instrument which you put in the sigmoid in the anus. You pass it through the rectum to the sigmoid. It has a light source and it has a camera. You can just look there and see those polyps are there. If they are there, they have the capacity to cut. You can cut some of those things and bring it to us in the lab. When we check under the microscope, there are signs of cancers in it, and we'll be able to quickly help out, and we can proceed with that. Now, the other part is colonoscopy. This is for me, it's the most useful tool in screening for colon cancer because it does not just end at the sigmoid. It screens. You can use colonoscopy goes through the whole length of the colon, where you are able to visualize. You are able to do all that the sigmoidoscopy is able to do. You are able to look at the polyps, cut the polyps, and take them to the lab and check if there are signs of cancer in it. This is what is advocated as the most preventive strategies for screening for colon cancer. Trust me, there is also expensive. We'll see a little. I'll show you some parts, some of the work some of my friends have done on comparing these methods, So colonoscopy is very, very vital in screening of colon cancer because we're able to see the cells directly and we're able to know what is in there. Now, there's this virtual colonoscopy. What do you do? What virtual colonoscopy is using CT scan. You do X-rays and you are able to you put all the X-rays up together and the computer is able to analyze those X-rays for you to be able to know. It's like doing colonoscopy without using colonoscope. The computer is able to analyze this X-rays for you. This CTs, call it computed tomography, colonography or CTC. So you put it together, you're able to know if there are polyps in there. But like I said, for me, because of the massive exposure to X-rays, it's not what I would suggest. Although it's very effective, but I wouldn't suggest it. There's a particular one I didn't mention here, but I'll talk about it later. There's also DNA stool test. This test checks DNA in stool cells for genetic changes that may be signs of colon cancer. So we need to. In this one, you need specialized training for this. You have to do DNA tests, you have to do DNA, in those things. Of course, in low socioeconomic area and, technologically poor environment like ours, it may be a challenge to do this. But when we are able to get it done, it's also a very useful tool. Now, this, Professor Latishe in Ife, did some work on comparing some of these methods. I told you there's a particular method I didn't mention. That's double contrast barium minima, where you put some things in the individual and you take X-rays and be able to look those contrast medium, those materials, you can see them through X-rays, and they're able to outline the wall of the stomach and the intestine for you to know if there are polyps there. So, but these methods have their own advantages and disadvantages. Like I said, the Oxford blood test is most cost-effective, although it's restricted diet and drug restriction required. These are the advantages. It has advantage and disadvantage, and I'll suggest that you can go through this paper. It's a very, very elucidating paper. It's very simple to read and be able to know advantage and disadvantage of those things. But more importantly is that a lot of these tests done for colon cancer screening are expensive. But I don't think anything is more expensive than our lives. You cannot buy, with all the money in the world, you cannot buy a single life back from death. So the earlier one does use the available tool you have. If it's simple occult blood, do it. And if you have opportunity of doing colonoscopy, which is available, is readily available in Nigeria. I know they do a lot of colonoscopy in Ife and in some other places in Nigeria. If you can afford it, or if you can put money together, and because you feel there are some symptoms you have, please go ahead and do it. It's for your own advantage. So what can I do to reduce my risk of colon cancer? People have talked about diet. Although, diets, there are recommended diets for so many reasons, but research is still going on to know the actual effect of diet in reducing this disease. You know why I said that? I'm saying that because some people think, if I eat well enough, I may not have cancer. I don't need to go and do screening. Screening is still the key. Why? Because, nobody's actually sure of what the effect of this diet will be. Of course, it's good to eat well. It's good to eat healthy, low animal fats, like I said earlier. We talk about red meat, which increases, diet. Of course, you have to eat food that is low in those kind of foods. High fiber diets, they are all good for, our health. When we eat, we help you eat healthy. Nevertheless, it's secondary, in my opinion, to screening. We must make an effort to screen ourselves, to decide that we must screen. Not because it is cheap, not because it is comfortable. Diet is comfortable, but screening is not. But we must go out of our way to screen for this disease and all the other cancers. Healthy living too is a very important, just making healthy choices, increasing your activity, exercises, keeping healthy weight, limiting alcohol consumption, of course, avoiding tobacco at all costs as much as you can. These choices, making those choices for our lives, which are difficult sometimes, especially if you have a habit that make you get into this. Of course, someone who is into tobacco has problem, is a habit that is difficult to stop. But if you make up your mind, seek help, of course, it can be stopped. Alcohol consumption, if you can make up your mind to reduce or actually avoid alcohol as much as you can, is also good. If you make up your mind also to, reduce your weight, because as we grow, we notice that our bellies increase, our weight. Even me, that used to be a thin, very thin guy when I was in secondary school, I noticed my weight is now, I don't know, and they used to call me some funny names because I was thin. But now nobody will call me thin these days, and that's not good enough for me. Of course, we need to do exercises, and that that's helpful for us. I'll be doing us a disservice if I don't also mention that there are the other cancers which we can easily screen for, like prostate cancer. As we're growing as individuals, as a man, prostate cancer is very, very, we are all prone to prostate cancer or enlargement of the prostate. And we can easily screen for this by going to the hospital, and I'm sure they will do, this what we call prostatics, prostate-specific antigen, are safe for us, and we can know if there's any problem there. Gastric cancer, of course, they will do endoscopy and sometimes biopsy, especially those who are ones as bladder cancer, you see blood in the urine, you don't take it for granted, you go screen. Cervical cancer, especially for our wives and those of women around us, some of these symptoms, you don't wait for symptoms to do cervical cancer screening. It's because cervical cancer does not kill in 10 years. If there's any cancer that I know that will give you time to screen and to prepare, it's cervical cancer. It's close to about and even with all the risk factors, after it will wait for about close to 10 years before it starts. So if the individuals are screening, if you have women who have been screening over time, you reduce the possibility of getting the cancer. And that is why in societies where you have routine cervical cancer screening, the incidence has reduced dramatically. We don't wait for symptoms in some of these cancers. It remains for me to thank you for listening to me, but I appreciate all your patience in listening to all my rhetorics. I'll be very happy to take questions now. Thank you.
Thank you, Dr. Osasan. We really appreciate your time. Thank you very much. Yeah. Please, if you have any question, can we make it as short as we can? And please, if you want to be a bit patient, by the time Stephen answers some of the questions, probably there's no need for us to answer again. Unfortunately, the chief host transferred it to Stephen. So, Stephen, you may have to be the one to. I would love to do that. Or if you want to transfer the chief host back to me, so I can monitor it. I can monitor it. By people are raising up their hands.
Okay, let's see if I can transfer back. Okay.
To Tunji, give it back to me.
All right. Okay, are you able to?
I should be able to.
Okay, so what do I do? Maybe people should indicate.
Yeah.
By raising up their hands or something.
Yes.
Hello. Hello.
Any question from anybody, please?
It's not good to be an illiterate.
Hello.
Hello.
I want to ask a question.
Yes,
Good evening, everybody. Good evening, everybody. Online.
Yeah.
Stephen, are you? I hope I'm audible enough.
Yes, we can hear you.
Yes, I can hear you.
Am I audible enough?
Yes.
Yes, I can hear you.
Yeah, Stephen, well done for the presentation. I think it's as comprehensive as possible. Thank you very much. All what I have in mind is what you covered. But my question has to do with the microbial infection, how viruses and bacteria, their contribution in the causation of, let's say, cancers. And of course, with reference to cancer of the colon. As a little digression, as a psychiatrist, let me let you know that maternal influenza virus, especially 1954 strain, has been implicated as one of the causative agents for mental disorders. So you see, there are maybe viral or microbial influence in causation of some other, illnesses and maybe other diseases like cancer. So coming to you now, you mentioned the issue of human papilloma virus as one of the causative agents in cancer of the colon. So I want to ask,
I didn't say cancer of the colon. I said cancer of the cervix.
Okay, sorry. I wanted to say cancer of the cervix. So okay. I want to ask that, okay, those microbial intervention or infection, is it a direct effect on those cancers? Is it a direct causation, or there's an interaction with already genetic predisposition that brings about these cancers?
Hey, you see, thank you very much. Yeah, I do. Thank you very much. You see, some of these agents some of them are direct, some of them are indirect. I don't know if I'm making sense to you.
Yeah, you are.
For example, Helicobacter pylori, right? Of course, Helicobacter pylori in the gut,
cancer of the stomach.
Yes, in the stomach. We induce, follicular expansion. The lymphoid. I don't want to go into this because of so many of our colleagues who are not to medicine. There will be increase in there'll be follicular expansion, and the most important thing we must know, let me put it straight to you, is that some of these cells, some of them are direct causative agents. Human papillomavirus is known for this. You understand what I'm saying? Especially the strains, 16 and 18. Especially, you know, their 16 strain. You know, it's a known, you know, they cause direct effects on the genetic makeup of the cervical of the cells of the cervix, especially the transformation zone. So one thing is this: is that, you know, for the purpose of the environment of our colleagues here, of a lot of our friends here, it is the best thing to put it straight is that exposure to these agents should be reduced. Example, you know, EBV in the causation of Burkitt lymphoma. Burkitt lymphoma is especially in the endemic Burkitt lymphoma, where you have some of the, you know, in low socioeconomic environments. Of course, the virus will be more in places where that's dirty, where there are there's malaria, there's lack of nutrition. Because of that, it makes it easy for those kind of agents to proliferate in such environments, and that's why you have such cancers more in those environments. Of course, you have Burkitt lymphoma. You don't have, you know, those kind of Burkitt lymphoma in the Western world, because you don't have as much EPV in them as what we have. Although there's still EPV there, but not as much.
Thank you.
I don't know if I need to answer your question.
Thank you, Stephen. Yeah. Can we go to Oshoro, please? Oshoro, can you unmute yourself? Then Ayomide Akinde, after then Shegun Abe. In that order. Yeah, go ahead, please, Oshoro. Wale.
Yeah. Good evening, everyone.
Good evening.
Stephen, thank you so much for the big grammar that you have spoken. Only that I did not study medicine, but
I'm sorry.
It was well understood. No, it was well understood, and I just want to ask a question about this, because oftentimes they keep telling us you still have to eat meat. You have to eat meat, because you talked about the red meat. That one caught my attention, because oftentimes when I go out and I see people eating, they can eat just 2 wraps of fufu and 10 pieces of meat in their plates, you know. So please try to educate me more on that. Is it that we should stop eating red meat outrightly, or we eat it sparingly?
I'll be a hypocrite to tell you to stop eating red. Thank you, Wale. I'll be a hypocrite to tell you to stop eating red meat, because I have more than enough red meat in my fridge or my freezer. But the fact still remains that these are scientifically proven facts that red meat, if you look at my slide, I said those who eat red meat are at increased risk of colon cancer. Not that you eat red meat, you have cancer immediately. Do you understand what I'm saying now? That is, you know, one thing about cancer is this. We must understand also, I try to not to say so many things, because, you know, cancer is a wide field. You know, for cancer to develop, there are multiple factors that can lead to cancer. There's genetics, there's environment, there's habit. So many of those things coalesce. But for individuals an individual who already has who is genetically predisposed to that cancer, or maybe you have a family history that you don't even know, or you already have a genetic predisposition to the cancer. All those other factors will help it. Why does someone who is, like someone who already has a genetic predisposition to that particular cancer, you now eat red meat, you are now smoking, you are now overweight, you have sedentary life. Of course, we are helping the cancer to develop. But individuals who don't have genetic predisposition to the cancer originally, they may eat the red meat and not have cancer. They may eat and have cancer, but it is known. It's a known fact that those who eat red meat have increased risk of having colon cancer compared to those who don't eat red meat. Having said that, I have red meat and I'm still going to eat one this evening. That doesn't change the fact that
Thank you.
Thank you, Stephen. I really appreciate that. Please, let's try and make a question as quick as possible so that we can all benefit. Yomi Akide, can we have you please unmute yourself? Thank you.
Good evening. Good evening.
Thank you.
Good evening, Stephen. You have done well.
Yeah. Thank you very much.
Well, you have spoken well. What my question was going to be in the area of gastric cancer, because you talked about it. You try to tell us different type of cancer. But the one I really want to ask questions about is that of gastric cancer. I want you to explain more, to give me more explanation about it, because I know it has to do with stomach, and so I really want to be more. I want to be more enlightened. I want you to throw more light into that. What is really gastric cancer? What are the causative factors? Then what are the symptoms? So these are my questions.
Thank you very much. You see, at the beginning, I mentioned the fact that cancer can develop in any part of the body. And the intestinal tract, I mean the GIT, what we call the gastrointestinal tract, is divided into different parts. And like you have mentioned, you have the esophagus, you have the stomach, which we call the gastric, the gastric area. Now, cancer of the stomach is also varied. It has different types, right? And like you have asked, there are so many factors. There are so many predisposing factors to it. One of them is what I mentioned, Helicobacter pylori, which is a microorganism that invades the stomach and usually causes what we call gastritis. Like I want to use right word. When you start feeling this, I don't want to call it ulcer, because gastric ulcer is different from gastritis. You have a kind of a relative inflammation of the wall of the stomach, and but it is not getting to the level of an ulceration. Ulceration is when you have a wound, an injury with a removal of the lining of that organ. Like if you have an ulcer on your skin now, it's different from when you have a bruise. Of course, a bruise will be there. You can see that there is redness, especially if you are light-skinned. You can see that something is red there, but it doesn't mean you have an injury. You have a wound. A wound is when you are, what you call a wound. You can see that there is a removal of the skin itself. That is a wound, and that is an ulcer. But when you have this, like a bruise, so-called, just excuse me for using that. That's why we have gastritis. But we know that Helicobacter pylori too, over time, can lead to this cancer. A lot of them, we call it moltoma. We call it is a kind of lymphoma, so-called. And there's also another type of cancer that we call adenocarcinoma, which is the cancer of that. I don't want to bug you with those names. But those kind of cancers can also develop there. But it is not just Helicobacter pylori that can cause gastric cancer. There are other factors that can cause it. Of course, even predisposition to like I said, genetic predisposition can cause it. Then, because the wall of the cancer, the wall of the stomach has the inner part, the wall itself, and the outer part. There are some cancers what we call gastrointestinal stomach tumor, which is common in the wall in the stomach. It's the most common. You can find it in other parts of the intestine, but it is more in the stomach. But what is important is this. When you have a symptom, go see your doctor. They can also do gastroscopy. They can look into that place, take what we call biopsy. Biopsy is taking a part of that tissue. That is the job. That is my main work. They will take part of that and send it to someone like me. I will look at it and see if those kind of cells, those kind of cancer cells are present, then we'll quickly know what to do. But if we just assume, which is the greatest problem, which is the emphasis of this presentation, is that we should stop assuming that cannot be us. A lot of Yoruba people have these interesting sayings that evil cannot. It's not here. It's not okay. It's somewhere far away from me, of course. But it is easier to say that, but it is better to find out that even if it is here, let me know so that I can really deal with it. But imagining that it is not possible with me is more dangerous. That assumption, which is I think it's common to all of us. It's not just even doctors, blacks, I lost a colleague, a professor of pathology actually, in late last year. It's very, very painful. You won't believe that this my colleague had cancer and he did not know until like 2 weeks before his death.
Wow, Professor.
It's every day it pains my brain that look. Of course, the guy was sick. It's not his fault. He was sick. He went to the hospital. They treated him, but he did not know it was cancer. That pains me every day when I think about it. So that is why we should just not assume. It's dangerous. We should not just assume that this is not possible. It is, yes, nobody prays for problems to come. And that is why I always tell my friends, especially doctors, that look, anybody when nobody prays to come to the hospital, nobody wake up in the morning and say that he will pray to God that he wants to go to the hospital today. That is why anybody who takes advantage of patients in the hospitals is incurring costs upon himself, because it's, disease will not have come to the world if God did not cause man. Do you understand? So our job is a job of, sorry to say this, medical profession is a profession to treat causes from God. So it takes a lot. If you now use that again and take advantage of people, you know what that means. So it's a lot of work in your mind. It's a lot of work when you need to understand the passion for this job. You can't be a doctor if you don't have a feeling you don't have an understanding of the scope of that job. Imagine that people don't, imagine that things cannot happen to you. It's a disservice to yourself. Imagine that, in Jesus' name, because it's not me. Yes, amen. It will not happen to you in Jesus' name. Amen. But you should scream. You should find out.
Thank you.
You should find out. There are simple things. Go tell your wife to do the pap smear. You have nothing to lose. It's better to do pap smear once every 3 years than to lose your wife to cervical cancer. It's better to do PSA than to lose yourself or your father or some people to prostate cancer. It's better to do this colonoscopy than to have colon cancer. Look, if Stephen, I'm sorry for saying this. I mean, I'm sure it's a bit offensive, but please understand me. If Stephen Olabi had done colonoscopy 4 years ago, 3 years ago, 2 years ago, probably even a year ago, you would have found the swelling there, and you probably would not have lost our colleague today. That is why the emphasis in this presentation is screening. Don't assume.
Thank you, Stephen. Really appreciate it. Olumide, please, can you mute yourself? I kept muting you. I think there's a background from you. Stephen, thank you very much, Stephen. Please, I know you have so many. We have 3 people that answer questions. We have we almost past our time now. If you can make your answer as quick, as short as you can, we will be well appreciated, please. Shegun Abi, please, Shegun, let's quickly hear from you, if you don't mind.
Good evening, everyone. Good evening, Dr. Stephen. Thanks so much for such a brilliantly delivered presentation and very informative. My question is, we've seen a lot of clips being shared around on social media. There's one
clip he said
about. Can you hear me?
Yeah, clip he said.
Yeah, there's one that was talking about the use of pumpkin seed for prostate cancer, and then there's another one that was saying eat black eye beans and some other thing, or do tomato smoothie. From a medical personnel point of view, what's your take on all these clips that has been shared around on social media? Is there any efficacy in them? Do they work as being claimed? Thank you.
Thank you very much, sir. Thank you. There was a time I was very worried about NAFDAC and all those FDA, approving a lot of these so-called diet supplements that heal diseases. I was worried and I was asking, why would they do some of these materials are not scientifically proven, so why are they approving them? Then I realized that it is the right, as long as they test those materials and they are not poisonous, as long as they are good for eating, it is acceptable, FDA can approve them. But one thing I'm sure is that I would suggest to you, and I'll tell you, anything that you cannot scientifically prove or does not have, they have not done enough studies. You see, for drugs to come out, they've gone through a lot of processes. You know, you will notice that one of the problems that the COVID vaccines had at that stage was the rapidity of the approval was because we needed that approval at that time. But naturally, you don't have vaccines that early. Why? Because for a drug to come out, they have to do so many trials. Different phases of the trials have to be done for those drugs to be approved for use. But a lot of these things, people say it is what our forefathers used to use, what we're using, but we don't have documentation of what our forefathers used, how many people died for using it, what happened to those who used them. We just know, they just tell you stories, you know, and we never tell you not to take them. But I will just say this, for anything you consume, sir, look at it, go and verify what I'm about to eat, what I'm taking into myself. Am I sure of it? As far as you are sure, there's no problem. If it's not poisonous, there's no harm in taking them. But for me, I will never tell you to go and take some of those things. I will not, because for me, as far as I cannot verify their scientific basis, I cannot say that to you. But whatever it's a choice that everybody has to take whatever they want. But notwithstanding, I will ask us to be very cautious. People say whatever they want to say. There was a time they said we should be using salt water to bathe for some things. I can't remember.
COVID.
So many things. People say anything they want to say, but it is you who want to consume them, you know, that should decide on the, you know, to decide if it's something you can. But you should, the only advice I will give to you is that if anybody says you should consume something, ask them to give you proof. Like Osasan will say, if you give an Osasan any drug, Osasan will tell you, have you taken it yourself? You know, if you have not taken it and it does not work for you, then why should you want me to take it?
Yeah.
Thank you.
Thank you, Stephen.
Absolutely.
Yeah,
Thank you very much.
Yeah. We have just two people now, so that we'll just end at after the two people. We have Brega and Olumide Adegboko again. So let's have Brega, please. Question quickly, if you don't mind. Unmute yourself, please. I've asked you to. Yeah.
Okay, thank you, Stephen, and thank you, gentlemen. I think it's, for me, it's been a very wonderful session. No time wasted. We've really enjoyed ourselves and we've learned new things. What is important is for us to put into practice all those things that we have said. I mean, there's no gainsaying at our age. We're above 50, we need to cut down on the few things that we do. If I also check my body weight too, I'm also slightly above 100 kg, which is not good. So I'm working seriously to ensure that I cut down on my body weight. So to others too, we need to put moderation into everything that we do so that we can enjoy this life to the fullest. So Stephen, thank you very much. It's been very professorial and we've really had a good time. And thank you, Shinji, for putting this together. Good evening, all.
Thank you, Brega. Thank you. We appreciate that feedback. Olumide Adegboko, please. Thank you. The last person who will be speaking tonight. Yeah.
Can I come up?
Yes, please. Go ahead. Thank you.
Yeah, I just want to, first of all, thank Stephen again for the presentation. I just want to add my voice to this issue of eating seed, eating one plant as a cure for one thing or the other. I want to inform you that all those things, I see it on the internet also, on YouTube and all that stuff, that they are alternative therapy practitioners that maybe publicize and talk about all these things. There is no hospital in the whole world you will get to and you will hear people talking about, or you hear doctors or nurses telling you, as far as the clinical practice is concerned, or medical practice is concerned, telling you, go and eat this seed, go and eat black seed, go and eat this leaf, and all that stuff. They are products of alternative therapies. They call themselves alternative therapy practitioners. It's like saying a kind of traditional or tradomedical stuff. Those are their claims. And where people claim it works, because I'm not an alternative practitioner, I may not know, but I've seen people that claim that those alternative practices, they work. You and I can give credence to all what the Indians and the Chinese, they do in terms of drink this tea, drink that tea, eat this leaf and all that stuff. All those things are alternative therapy, whatever. But they are not what enemy or the medical community in the whole world is not what they do. Now, talking about approval, now that approval is that it is good for consumption. Like Steven said, they are not toxic, not approval for efficacy for what they claim. That's one I'm sure. So they can be given license that they can market it anywhere that is not poisonous. But it's not that, it can actually do what they claim it does. So that's about those seed stuff. Then I want to also add one word to the issue of red meat. You see, red meat has not only been implicated in cancer issues. Most especially the consumption of red meat has been implicated in the causation of high blood pressure and probably obesity.
Yeah.
Certainly, obesity is like a predisposition or family member of high blood pressure. Go and check if people that are obese or overweight, more than 50, 60, 70% of them, they have high blood pressure. So it's in the management or the treatment of so many diseases that red meat has been implicated, and people are advised. This is even medical. This is highly medical, not alternative therapy. This is highly medical, that has been clinically proven. So when you reduce or you boycott or avoid red meat, generally, your high blood pressure improves, it drops, and your weight drops. In fact, a consultant cardiologist spoke, in our meeting just a few weeks ago.
Yeah, thank you very much, Olumide.
That for every 5 kilograms by at least about 2 to 3 millimeters of mercury, it has been proven. So that is the issue already. So when I talk to people concerning dietary modification or other kinds of management for high blood pressure, obesity, and all that, I tell them that you can, if you still want to eat meat, you can eat meat. You can eat probably goat meat. At least if you want to eat it, but I tell them that for me, I would say don't even eat it at all. Why can't you eat other things more? And for me, right now, I major on fishes. And only on occasions I take meat, and I've been fine. So it has controlled my own personal weight. Yeah. Thank you very much. I don't want to talk too much.
Thank you, Olumide. Thank you for your input. Yeah, we've come to the end of this session. Stephen Osasan, we can't thank you enough, and those that have contributed as well. I want to believe it's no waste of time for us to be here. Information is key. And I will listen more than that. Thank you very much once again, everybody, for coming, and wish you happy Easter. By God's grace, we'll be here together the next Easter, good health, and we enjoy the fruit of our labor.
Merci beaucoup.
Yeah, thank you, everybody. That ends the session.
Thank you very much.
Thanks for
God bless
attending. Stand here.
Thank you.
So I'm stopping the recording now. You can have your chat if you want to chat.
Recording stopped.